The coronavirus. Now that I got your attention, I just wanted to share with you a study that came out last week in the Chinese Center for Disease Control and Prevention. It was the largest analysis of coronavirus cases to date. Although men and women have been infected in roughly equal numbers, researchers found the death rate among men was 2.8, while the death rate among women was 1.7. Now, this isn't necessarily about COVID-19, our current virus that has us all upset. It's about all the coronaviruses, SARS and MERS, etc. But I wanted to bring this to your attention because in light of the class that I just taught on Saturday in East Lansing, Okemos area in Michigan, which is about epigenetics, or your DNA is not your destiny, it's called, and the difference between genetics and epigenetics, genetics being something we really can't do much about, and epigenetics is something that is in our control, about how we can have a say in what genes are expressed and what genes are not expressed. This study is about basically how, flat out, it says that men are more affected by the coronavirus than women are. And then it goes on to talk about, well, why is that? Is it through biology or genetics? Men have only one X chromosome where women have two. And can they do anything about that? I don't think they can wish another X chromosome on them. I don't think they can wish to have more estrogen. They've got what they've got in that way. But in terms of, taking care of yourself, worrying about germs, right? And not touching our face. And the big one is washing your hands. There have been studies that show that men do not wash their hands as often as women, and oftentimes they don't even use soap. Now, this goes for men also in the healthcare industry, which is a little freaky to me. These are studies. This is not me. This is all from a study. So let's just think about that as I talk about some of these things that were found in this analysis that came out last week. More women than men were infected by SARS in Hong Kong in 2003, but the death rate among men was 50% higher, according to a study published in the Annals of Internal Medicine. Some 32% of men infected with Middle East respiratory syndrome died, compared with 25.8% of women. Young adult men also died at higher rates than female peers during the influenza epidemic of 1918. So, men can have worse outcomes in many viral infections of the respiratory system. Traditionally, historically, more men than women have smoked. It's true. So that, might be something with the respiratory system. And they've just found also that women fight off viruses better, which could be about that X chromosome again, and perhaps the estrogen. Dr. Janine Clayton says that there's just something about the immune system in females that is more exuberant. And she's from the Office of Research on Women's Health at the National Institute of Health. So there's that. And then there's also what they're finding out now about this particular virus, the COVID-19, and that is that they're finding that it's worse in people that are above the age of 60, and particularly around the age of 80 and above. It can be very serious. And so that's another thing. You can kind of compare biology versus lifestyle, or not exactly that, but you can get a facelift, you can exercise, you can eat well, you can take anti-aging supplements, but you're still going to have that birthday come around and you're still going to get older. And hopefully some of those things that we do to keep our immune system high in order to fight virus generally will help us, although we know that this particular COVID-19 is a new virus, and so there's no way that we have been able to build up an immune response to that particular virus. Perhaps just generalized high immunity or high good healthy immune system will help us in general, but we don't have any data on that as yet. So again, I just wanted to share this as it kind of related to my class that I had in Okemos last Saturday, and that it was a wonderful class. That students were wonderful and they gained a lot. But it's kind of about this. So take care and do wash your hands, gentlemen and ladies. Thank you. My name is Darcy Lewis, and I'm from Connected Learning. Take care.